So tell me a little bit about what brings you in today.
I was in a car crash a few weeks ago, and ever since then my neck has just been hurting really bad. My head hurts.
Okay. So the car accident, can you tell me a little bit about that? Were you hit from behind, the side? Did you feel your head move?
I was at a red light and I was rear-ended, and so I kind of put my head into the steering wheel.
Okay. And then did it come back and hit?
Yeah.
All right.
I think so.
So how would you describe your pain in your neck?
It's kind of dull and achy.
And then the headaches, how would you describe those?
They are just like really sharp for a little bit, and they kind of come up like this way.
She's been complaining a lot of like neck stiffness and kind of like up here on the back stuff.
Okay. So when you're moving your head around or trying to look, does that recreate your headaches and the pain in your neck?
Yeah.
I see here it says that you're having trouble concentrating in school and sitting, looking at the computer for longer than an hour. Are you doing anything that makes the pain better?
When my head hurts or my neck hurts, I just go lay down in the dark room with my hopes.
We've been keeping her out of school. She usually just does about half days.
Any medications?
Yeah. So we tried aspirin for a while. It didn't work, and then her doctor prescribed some Vicodin. So the Vicodin's been helping a little bit better than the aspirin.
Alright. And then, do you ever get dizzy with those head movements?
Yeah,
Headaches?
sometimes, especially if I turn my head really fast, I'll get dizzy for a second.
Okay, but then it goes away. Good. And then, what are your goals out of therapy?
Just to get back to like playing soccer and going a full day in school.
Not anything?
Yeah,
Okay.
I would really like her to get back to school, be able to focus on that because it's her senior year. So, and on a good note, right, honey?
Alright, Stephanie, so I'm going to check some of your range of motion. So what I want you to do for me, you can just stay seated, but I want you to look up as far as you can. Any pain with that at all?
It's a little stiff.
Okay, and then I want you to tuck your chin and look down as far. Any pain with that one?
Just a little stiff.
And then look over your shoulders. Pain.
Just stiffness.
And is that the same stiffness you're feeling when your headaches come on? Are you feeling any headache symptoms right now?
Not really, no, but it is the same stiffness for me.
Okay. And then I'm going to have you cross your arms in front of your chest. And you're just going to go up as far as you can. And then down. Any pain with either of those?
Not really, no.
Okay. And then to the side. Pain with those? Okay. And then just dipping. Great. Any pain with that at all?
No.
Okay. Stephanie, so next what I want to do is get a feel for how those muscles in your neck are working. So I'm just going to ask, I'm going to put my hands on your head. Is that okay? Alright. So what I want you to do, I want you to look down, just press into my hand. Good. Any pain with that?
I'm just a little stiff.
Stiffness, okay. And then push back into my hand. Any pain with that?
Just a little stiff.
Side of the leg. Push into my hand with that here. Any pain with that?
Not too bad.
Over here. Push, push. Good. I'm going to ask you to try and look towards the right and just push into my hand. Any pain with that one?
That one hurts a little bit more.
And is that the same pain that you've been getting
Yeah.
when you're turning your head? Okay, and we're just going to do this side. And same thing with that. Alright, Stephanie, so I would like to perform a test called the high man on you. This is just going to kind of look at your balance, how you're running, jumping, so we can get you back to playing soccer. Is that okay?
So why are you going to do that test on her versus other assessments, I guess?
This test is shown to be really good for younger people, especially those athletes like Stephanie is, and especially for injuries related to a suspected concussion.
Okay.
Alright, Stephanie, what I want you to do is I want you to run as fast but as safely as possible. Next, we're going to skip the same distance and remember to be as safe as you can. Alright, next we're going to hop for 10 meters. What you're going to do is you're going to stand on one foot and then hop forward on that same foot for 10 meters. Next, you're going to start at this line. What you're going to do is you're going to jump from one leg to the other with your hands on your hips. Then you're going to do that 3 times and we'll take an average of them. Great. Alright, so next I'm going to check some of the ligaments in your neck and just make sure everything's okay, right? I want you to keep your eyes open and look at my nose, and then once I turn your head, I want you to count backwards from 10, okay?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good. Any problems with that at all? Alright, next, just relax your head down. Relax your head. There you go. Very good. Then I'm going to just come up a little bit and turn your head, okay? Let me know if anything hurts, if you get dizzy at all, any symptoms. Very good. You can go ahead and sit on up. Alright, so the next thing we're going to check is how your eyes are moving, and let me know if you get any symptoms of dizziness, nausea, anything while we're doing this, okay? What I want you to do is look right at my finger and just follow it with your eyes, okay? Keeping your head still. Okay, good. Any problems with that at all? Perfect. Alright, Stephanie, so next what I'm going to do is I'm going to do some what we call mobilizations on your back, kind of feeling on your spine a little bit. Hopefully it'll get some movement back for you, okay?
So why are you doing things on her back when it's her neck that hurts?
So research has shown that even though the stiffness is up in her neck, that if we play around with the thoracic spine, kind of this area of her, it'll help improve that range of motion up here or down here. So what we're going to do is stretch to kind of loosen up that neck a little bit. What you're going to do is you're going to bring your ear towards your shoulder, and then you're going to look towards your armpit. Do you feel any stretch back here? Any pain? Not really, no. Okay, good. And then as we progress with that, you're going to hold it for 30 seconds or less if that hurts too much. But as we progress, you're going to do the same thing, your ear looking down towards that armpit, and then you're going to just kind of press a little more to get a little more stretch. Okay? Alright, and then the next one we're going to do is just bringing your ear down. Do you feel a stretch in a little bit of a different place in your neck? Good. And then same thing with that one, 30 seconds for as long as you can, and when that gets too easy, bringing that up and stretching. Does that reproduce any of your symptoms? Not really. Any headache, dizziness? Good. So the exercise I'm going to teach you next is kind of because when we were looking at your range of motion or how you were moving your neck, you seemed stiff when looking to the side. So this is going to kind of be a home exercise that will replace my hands and will help mobilize that neck and give you that movement without having to come into the clinic, okay? So what you're going to do is you're going to start with your arms crossed. We're going to work on looking towards our right. So cross our arms, our left's going to be on the bottom, stabilizing here. The top hand is going to kind of come up. You're stabilizing with the bottom. Top is helping pull and look to the right, okay? And you hold it for about 5 seconds over here, and then you're just slowly coming back to the starting position. And you're not moving your entire neck, just yourself. You're really focusing on pulling with that top hand, okay? Crossing up and stabilizing there.
So how often should I have her do this at home?
She can do this 2 times a day at home, do about 10 to 12 reps. If it is uncomfortable, if you're getting any of those symptoms that are in your neck or in your upper back or headaches or dizziness or anything, cut it down and stop doing the exercise and then try again the next day. Alright, so do we have any questions right now?
When can I go back to playing soccer?
So I don't want you heading back to soccer yet, kind of because of those headaches. We're still moving around pretty stiff. But let's start with trying to get you back into school more, looking at your computer, taking notes and everything without those headaches and those symptoms happening, okay?
So what types of things that should she be working on and what you're going to be working on here is going to help her get back to practice and like soccer?
Okay, one of the things that we noticed from the high mat score, that test that we did, the running was a little lower than we would have liked to see it. So I think we should start here and at home. Some part of her exercise plan at home is to start running, start off slow speeds, and we're going to gradually increase those to get back to playing soccer.
Okay, good.